Hi everybody, I'm Brian Scarpelli at ACT, the App Association, and this is your regulatory update. First, right now the Federal Communications Commission is considering making some regulatory changes to speed up the deployment of broadband infrastructure in order to encourage adoption of 5G networks. We're really supportive of that, working closely with the FCC on it, and you can look forward to just 2 days from now, the FCC adopting a proposed rule to advance 5G deployment across the USA. With the Federal Trade Commission, we've been engaged most of this year towards informing their efforts as they hold new hearings on consumer protection and competition issues generally, and whether some changes need to be made to how the FTC regulates. They've issued a massive sweeping call for comment, and on behalf of the developer community, we filed on 8 of 11 questions, so 8 separate comments with the Federal Trade Commission, and have gone in and met with them to impress our views on them, make sure that your voice is being heard, and we're continuing to fight to be part of these hearings and staying on top of these hearings throughout January 2019 and beyond. In the healthcare space, there's a whole bunch of interesting regulatory level developments going on right now. Probably the most important ones are, again, back at the Federal Communications Commission, a new proposal to adopt a Connected Care pilot program, which would be a $100 million grant program that's intended to subsidize remote monitoring being used in rural and underserved areas in order to benefit underserved Americans and other vulnerable populations like veterans through new remote monitoring deployments. We've been really engaged with FCC Commissioner Brendan Carr and other parts of the Federal Communications Commission as they stand this program up, and a big step was taken when they adopted a call for input on it, a notice of inquiry on the idea. We'll have to keep working with them as that program becomes more solidifies and becomes more real. Looking at sometime next year, them actually giving these grants out. Separately, but within the healthcare space, CMS, the Centers for Medicare and Medicaid Services, at our urging, has proposed some pretty revolutionary changes to their regulations that would, in effect, finally provide providers, and by that I mean doctors and qualified healthcare professionals and clinicians and other caregivers, financial incentives in the Medicare program for using not just Medicare telehealth services, which are a live voice or video call, but remote monitoring innovations that like sensors one could wear that collect biometric data, get shot up to a platform, analyzed for real-time decisions being made. All those technologies up until this year have been pretty much ignored by the Medicare program, and we're set at this point to finally attain reimbursement for the use of remote monitoring services for any chronic condition. It's been a lot of years in the making. They proposed the rule, and we filed some pretty detailed comments with the Centers for Medicare and Medicaid Services on September 10th to urge them to finalize their proposal, make a few tweaks that we felt were needed. We're looking at mid to late November when the final rule will be released and the regs go into effect on January 1. Thanks for watching. Talk to you soon.